I'm Bill Slicker, the incoming District Rotary Foundation Chair for 2016-17, and today we're going to hear from two people. Owen Devlin will share his knowledge of our district grants, and Glen Rowe will talk about the global grants and our polio eradication initiative. Thank you for watching and your support of the Rotary Foundation and Rotary International.
Well, district grants are small-scale community service projects that last for 1 year. And for the district, we give grants up to $4,000 per club. And the way to get a grant is to fill out an application, which are available on the website. It's a 2-page form, which your club president will sign, and then you'll have 2 other members sign and turn in a description of the grant. And they're wide open as far as what type of things can be done. Often there are scholarships. About half the grant money is for scholarships. But we do a lot of other projects that probably may not qualify for global grants. The sustainability question looms large for global grants, and Glenn will talk about that. But for district grants, we don't have to worry about that question. And the district grants are pre-funded by your club. You pay the costs of the project, and then after the project is finished, you turn in a final report describing what happened and turn in receipts, and then the district will write a check to your club for half of the costs, up to $4,000. We don't cover 100% of the project. It's basically half of it with a cap of $4,000. Because of the dollar amounts, we don't have unlimited funds, so we set a $4,000 per club. And the club has to qualify by paying all the dues to the Rotary International, so there are qualifications. Your 990 forms have to be filed properly, so you have to be in good standing as a club. So that's critical. And then once a year, send someone to the training like we're having today and like what we had in February. So those are the basic criteria for district grants. And the forms are available on the district website. There's a link to foundations, and you go to that foundations page, and on the very bottom of it, all of the forms. And there's an email address where you will email the forms. We don't like paper anymore. We want to receive your application, which needs to be signed. We'd like to see it in a PDF copy, and then email it to the web. We have a Gmail account where we're receiving all these applications. What we do is district grants are annual grants. So the initial applications are sent in by July 31st. So you would fill out the paperwork anytime from now to July 31st. This is the grant application form. You would email it in. Our deadline is that, I know I'm repeating myself, July 31st deadline. At that point, we gather up all of the applications. We have an allocation where the monies are allocated. And then we go online to Rotary Foundation and we put in all of the applications, and obviously in very summary form. They have a template. So the foundation has to clear these. They look at these, and they do flag grants that they don't like, in which case we go back to the club, gather up more information, or tell the club that the foundation hasn't approved it. Sometimes they're international grants, and you may be going into a country that the Department of Treasury has on a restricted list. They do the legwork on that. There's a database where you have to check where there are restrictions. And so long and short of it is, then in August, we will tell you whether you have your grant. So apply by July. We'll tell you by the end of August, because we have to go through our processes. By the end of August, you'll know if you have the grant and the amount. So figure it'll be less than 4,000 because we have to prorate. And so once in August happens, then after that, you complete the grant. Whenever you complete it, you can turn in the paperwork and get a check. You don't have to wait to the end of the fiscal year. You can turn it around and get the money right away. But we want the disbursements to happen in the fiscal year.
I did this for last fall, and a lot of people have heard of Polio Plus and the eradication of polio, but they don't really understand it. So I made this little presentation, and we'll go through it pretty quickly. Polio is a highly infectious disease caused by a virus that invades the nervous system, causing paralysis. And it's kind of unique. The only host are humans. You've heard of bird flu, you've heard of swine flu and all the things, and malaria and all that comes from different animals. Polio is only a human. You're both a vector and a victim of polio. And it usually comes through the fecal-oral route. 1988 is the magic year. Rotary started their process in 1985. They rolled it out in 1986. They pulled it back. They reworked it, came back in 1987 with called Polio Plus, and started raising money in 1987. And the district conference, or the international conference in 1988, they announced the results and they started writing money to the polio. So 1988 is the year that this thing really kicked off. And every day, in 1988 and before, every day, 1,000 new cases of polio around the world. 365,000 new cases every year, and that's what the world looked like. The red was polio endemic, and the brown was polio-free in 1988. The initiative was a public-private partnership led by national governments and spearheaded by RI, WHO, and CDC and UNICEF, and the Bill and Melinda Gates Foundation. And its goal is to eradicate polio worldwide. Rotary started, and Rotary is the cheerleader for this effort and has been for the last 30 years. The roles, Rotary International, through its Polio Plus program, was the first to have a vision of a polio-free world, second largest private sector donor of the effort. And our responsibilities are fundraising, advocacy, and volunteer recruitment. And we provide valuable field support during National Immunization Days. Rotarians go around the world and give drops to kids. World Health Organization coordinates the major strategic planning, management, administration of it. It is responsible for collection, collation, dissemination of standardized information. We're trying to get this stuff so everybody's on the same page. And it coordinates operational and basic research and technical support to ministries of health in various countries. CDC buys the oral vaccine. It's the funding mechanism for it. And it's also the viral detective. It uses state-of-the-art surveillance expertise to investigate outbreaks, identify the strain, and pinpoints the geographical origin. Why is that important? If a polio case hits in a non-endemic country, a country that's been cleared, then they want to know where that polio came from, so they go straight back to that country and start fighting it. So it's very important that they identify where it came from and the kind of polio it is. And UNICEF, it distributes the vaccines for routine immunizations, helps countries develop communication strategies, which are very important because a lot of these companies don't trust Rotary. They don't trust people to come in and give them so it's a lot of communication and a lot of access to hard reach places and things like that. And that's what UNICEF does. And then Bill and Melinda Gates is the largest private foundation funding source of the thing. And they coordinate high-level government advocacy and valuable partnerships. That's very important. We'll talk about that a little bit later, what Bill Gates has done. 1991, 3-year-old boy living in northern Peru Who breaks the world into regions? Americas, Western, Pacific, blah, blah, blah. The Americas region, 1991, last boy in northern Peru was the last one reported polio. Takes 3 years to certify an area polio-free after the last known case of polio. Takes 3 years. So 1994, 88, 89, 90, 1, 2, 3, 4. It took 6 years to get the Americas clear of polio after we started the initiative. Give you an idea how tough this stuff is. 1996, Nelson Mandela launched Kick Polio out of Africa. 40 million children were vaccinated during some NIDs. 1997 was the last polio in the Western Pacific, 15-month-old girl in Phnom Penh, Cambodia. And in 2000, Western Pacific, including China, the most populous country in the world, was done in 2000. 12 years after we started the initiative, we got the largest country in the world out of it. 98, 33-year-old child in Turkey. There you go. And so the European region was after China. You think of Europe and you think of the Southern Pacific, you'd think that Europe would be ahead of them, but that's not true. We got the Pacific before we got Europe. In 2011, an 18-month-old girl was in India, and India was certified in 2014, the second most populous country in the world. Now, here's some these can glaze your eyes on statistics, but I'm a CPA, so I like spreadsheets. So, up to 2005, we had spent we being all the total effort for polio eradication, had spent $965 million. In 2005, we spent almost $1 billion. We spent $4,273,000,000 total from 1988 to 2005, eradicating polio, and we'd gotten it down from 365,000 cases down to 2,000 by 2005. 2006, we spent another $500 million, and we lopped off 5 more. Very expensive to get these things going. 2007, we spent $750 million, and we lopped off about 650. 2008, we lost ground. We spent $500 million, and people started going across country borders, and polio started popping up. 2009, we spent another $600 million, and we knocked off 50 cases. Not an easy trek for us. 2010, we spent $800 million, and we knocked off about 300, about 250, 240. 2011, we cut it in half. Spent almost $1 billion in 2011. 12, we cut that by a third. Spent $1 billion knocking this thing off. We'd spent $10 billion so far through 2012. Rotary had put in $1.2 billion at that point. Bill and Melinda Gates Foundation had surpassed us at that point, and they'd spent $1.4 billion in the effort. 2013, we spent almost another $1 billion, and we lost ground again, back up to 385 cases. 2014, we lopped a little bit off, another $1 billion. We spent $12 billion. 15, the numbers are not in, but 15, we were down to 73 cases, and today we're up to 5 so far this year. Pakistan and Afghanistan are the 2 places. And Pakistan was the bad one, and last week Afghanistan came up with 1. So we're still fighting the effort. There's 1988. That's what we looked like in 2014, with the one exception that Nigeria, we hope, will go away, and we will end up in that little area right there, and that is one of the toughest areas in the world to be around, because they kill you there. They seriously are ugly. Now I want to give you a juxtaposition on this. Smallpox took 14 years to eradicate smallpox. It was eradicated in 1979 at a total cost of $70 million. We've spent $12 billion getting rid of polio. Why was smallpox so important? Because every year, smallpox killed 50 million people around the world. Every year. It was literally depopulating the world. And we couldn't let that keep going. So that was the first one. Smallpox was easy compared to polio. You get one smallpox, you're immunized for life. Polio, it takes 5 turns to get you immunized. So when you go into India and you say, we eradicated polio in India or China, that means that you've been through there 5 times to get every kid immunized 5 times. Here's what UNICEF said about Rotary. Rotary International's role in the global effort to eradicate polio cannot be overstated. Since Rotary first met its funding pledge in 1985, it has consistently fueled the effort with resources, advocacy, and genuine hard work on the ground. Rotary's advocacy efforts with both endemic and donor country governments have maintained the dream of a polio-free world over the last 30 years and brought polio to the brink of eradication. Rotary International trustee Greg Pod told us last year at Zone that Rotary expects to share the Nobel Prize with Bill and Melinda Gates Foundation after this is over with. So this is the level of organization that you are in. Rotaries, I get this question a lot. What's the next initiative after polio? The answer is, according to the trustees, these are the initiatives. This is where Rotary's going. Everything is based on this model, and so we've been working at it for 4 years, and Bill's going to take it up, and this is the Rotary model from here on out. So you need to learn about global grants. You need to get involved in global grants. You need to participate in them. You need to get other clubs in the district participating with you so that they understand, because it is a major, major, major effort on many clubs' part. It scares the heck out of them to think that they're going to step out and do a global grant. But if you're doing a global grant and you need $1,000, introduce them to the process, you guys especially. Okay? That's it.